Dallas make it hurt.
Thank you. So my section of the program is talking about what happened in our state government. One thing that the Poor People's Campaign has taught me, a phrase that the Poor People's Campaign has taught me, is that you only get what you're organized to take. Right. Because asking all the ways that we've asked doesn't work, right? So we need to demand it. Some of the things that we demand are some of these pieces of legislation that folks are talking about. And really, I'm here to talk about like what the heck happened, right? But we know the answer. Mercedes, do we have coverage for all? We don't have coverage for all.
No, we don't.
Do we have the New York Health Act?
No, we don't.
We don't.
No.
Do we have fair pay for home care?
No.
Is our medical debt wiped out?
No.
No. We got like peanuts. Like we have not seen any fundamental change that's going to change any of the systems that are causing the pain that people are talking about right now. Our home care workers got a raise. Not nearly enough. And guess what? Because they got that raise, they got punished, and they didn't get the bonus that other frontline healthcare workers got. Everyone should have got that. They all deserve it. New York Health Act. How long? How long have we been fighting for the New York Health Act?
40 years.
Right. 40 years. Coverage for all. We got some incremental, benefits to some people. Some people who are over age 65. Mothers who just gave birth, but we're not there yet. Ending medical debt, same thing. Incremental changes, we didn't solve the problem. So sitting here, thinking about all of that has really, it really gets me down. But I'm really glad to be here with all of you because we continue to fight for all of those things.
Yes, we do.
We can't afford not to, right?
That's right.
So, with that, I think we're going to hear a little bit more about continuing the fight, talking to people, canvassing, getting more stories, because we can't stop. Thank you.
Definitely not.
That's right.
Thanks. Yeah, Katie.
Yeah, Katie. Thank you.
Can you hear me? You can usually hear me. Yes, you can.
A little louder.
A little louder. Hello. My name is Julie Farrar, and I represent the Independent Living Center of the Hudson Valley, Capital Region Adapt, Caring Majority, and the Poor People's Campaign. I also, I want to share a little bit of my personal experiences during the pandemic, during the COVID pandemic. My job was to help veterans get out of nursing homes and get into their own homes or stay in their own homes to avoid being in a nursing home. When COVID started, it was mid-March 2020, I believe, my brother called me from a COVID hospital. He's been working in a COVID hospital nonstop in Denver, Colorado, on the intubation team. He called me and he said, I have never seen anything like this. Do not leave your home. And for the most part, I did not leave my home. Within the next 2 weeks, the nursing homes and the hospitals started rapidly discharging all of the veterans, all of the people that were expendable, all of the people that they needed to get rid of to make room for COVID patients. And in the nursing homes called misnamed skilled nursing facilities to send diversion COVID patients. So these were patients that had been in intensive care, that were fighting for their lives, that had been stepped down from intensive care, which is 24-hour nursing care, and then sent to nursing homes. A little dirty secret about nursing homes is every single winter they shut down because of the flu. They shut down and no one is allowed in or out because they are germ cesspools. They became COVID cesspools. I had people, families, that were sent home to their families that were infected with COVID by COVID diversion patients, and then they infected their entire families. They had home care providers. I had 45 veterans who died during COVID. This does not include family members. This does not include home care workers that lost their lives because they were intentionally infected with COVID because Governor Cuomo diverted patients to nursing homes that had shared eating facilities, shared bathing facilities, had absolutely no ability to quarantine their patients. We worked so hard with Caring Majority on getting fair pay for home care passed so that home care workers who never got PPE, who put their lives on the line and saved God knows how many people in New York State by providing care to people in their homes, they got enough of a raise to put them over the benefits cliff. So they were making such a small amount of money. It was $12.30 an hour. They got enough of a raise that they will lose their health insurance. They will lose their child care stipends. They will lose their rent subsidies. They will lose their heating and utilities subsidies. They will be much worse off unless they cut their hours. And another thing that has happened is that we have not passed a tax break that would allow seniors to age in place by making their homes accessible so they can age in place and stay in their own homes. Instead, Governor Hochul removed all of the protections for renters and gave billions to the industry, the landowners industry, the exploitation in the real estate industry that is going to lead to homelessness. I really think that that COVID and the pandemic has taught us some great things about healthcare. Yeah. One of the things that happened is that President Biden expanded access to Medicaid for millions of Americans. If they did not have this expanded access to Medicaid, we would have seen people have to file for bankruptcy. We would see people lose their homes. We would see people becoming homeless to try to pay into the very same industries that killed Danny, the big pharma, the hospital associations, the for-profit nursing homes, whose bottom line is a profit margin, not the people. We absolutely, positively must pass the New York Health Act, and we must fully fund fair pay for all. The fight is not over. Human beings deserve health care. Health care is a human right.
Yeah.
Thank you.
Thank you. Hey, Joe.
To urge that our state legislature bring the New York Health Act to a vote in the legislature. This legislation is similar to Medicare for All on the federal level and would enhance our current health services to fully cover dental, vision, hearing, and even long-term care services with no out-of-pocket costs.
Hold it closer to your mouth.
It would be funded by a payroll tax on people earning over $25,000 a year and would result in significant savings to employers and working people. Specifically, it would eliminate the need for marketing and advertising, as well as be administratively less costly. This savings could then be used to provide the additional services that are not presently covered. As you can imagine, the healthcare industry is lobbying very heavily against the Act's passage. For example, CVS has donated $5 million to oppose the passage of Medicare for all on the federal level, as it would cut their profits. Let me count just some of the ways the passage of the New York Health Act would improve our lives. More services for everyone at a lower cost. 2, our property taxes could be cut since most of that revenue goes to paying for Medicaid. 3, in cases of catastrophic injuries and illnesses, we would be fully covered, thus reducing the stress on families and communities to assist them, as well as reducing medical debt, which is a leading cause of personal bankruptcy. Since long-term care is covered, there would be home care benefits, and when needed, a much easier transition to nursing homes and rehab facilities. And finally, since state and county governments would realize significant savings, these monies could be used to increase needed services. I favor this legislation not only because it's fiscally sound, but also on the grounds of social justice. Specifically, we are all well aware that the disadvantaged have been most severely affected by COVID, and that those benefiting from the present arrangement are profiting greatly at the expense of us all. The time for the legislature to act is now. Our revenues have put us in a good position to do so, and we should move forward on a sound and equitable basis for all New Yorkers.
Yeah.
When this country prioritizes profits over the care of its people, it is not a health care system. It is a money-making health service.
Mercedes said, "Hello, my name is Mercedes. I live in Albany, New York. As a single undocumented mother battling cancer, it has been extremely difficult during the pandemic to meet ends meet. The rising costs of food, utilities, and rent have not made it any easier. All New Yorkers, regardless of immigration status, should have access to health care. We need to expand health care coverage to all New Yorkers because health care is a human right.
Right.
The
Yeah.
legislature failed to include health coverage for all, but we will continue to fight until they include health coverage for all in the next state budget. The fight goes on." Thank you.
Thank you.
Above my head, I see peace in the air. And I really do believe, a change is coming out there.
People like to talk about how much guaranteed health care would cost, but then they don't mention how much we send away in bombs and weapons overseas, right? Killing other